Hello everyone, welcome to a fascinating journey inside your own body. Today we're diving into serotonin, your body's natural mood regulator, often called the happy chemical. It's a tiny molecule with a huge impact on how you feel, think, and even how you sleep. Serotonin is a powerful chemical messenger that keeps your spirits high, your mind calm, and your sleep on track. It helps you wake up feeling refreshed, enjoy moments with friends, and wind down at night. But serotonin's job doesn't stop at mood. It also helps regulate your sleep cycles, supports healthy digestion, assists in blood clotting, and even plays a role in sexual desire and appetite. It's truly a multitasker. Here's something surprising. Most of your serotonin isn't in your brain, but in your gut. In fact, about 90% of it is produced in your digestive system, with the rest made in your brain. The building block for serotonin is an amino acid called tryptophan, which your body gets from foods like turkey, nuts, and cheese. Eating a balanced diet helps your body make enough serotonin to keep you feeling your best. Once you eat these foods, your body converts tryptophan into serotonin through a series of complex steps. This serotonin then travels to where it's needed, helping your body and mind stay in sync. Maintaining the right balance is crucial. Too little or too much can cause problems. Low serotonin can lead to mood swings, trouble sleeping, or digestive issues, while too much can also be harmful. When serotonin levels are just right, you feel focused, stable, and content. You're able to handle stress, stay motivated, and enjoy life's little moments. But if this balance is disrupted, your whole system can be thrown off. You might feel anxious, irritable, or even physically unwell. Understanding serotonin's role is the first step to protecting your health. By learning how it works, you can make better choices for your mind and body. Let's explore what happens when this delicate balance goes wrong, and how you can support your body's happy messenger every day. Now, let's talk about what happens when you have too much serotonin, Serotonin Syndrome. This is a potentially dangerous reaction caused by an overload of serotonin in your nervous system. It can develop rapidly, often within hours of starting or increasing certain medications. Most cases are triggered by drugs that boost serotonin, like antidepressants, especially when combined. Some drugs release more serotonin, others prevent its breakdown, and some block its reabsorption. Combining these increases your risk significantly. Serotonin syndrome isn't rare. Anyone taking serotonergic medications is at risk. The good news: it's preventable and treatable if caught early. Recognizing the risk and understanding your medications is key. Awareness is your best defense. Let's get specific about what can trigger serotonin syndrome. The most common culprits are prescription antidepressants, especially when combined, like SSRIs with MAOIs, but it's not just antidepressants. Painkillers like tramadol, migraine drugs called triptans, and even over-the-counter cold medicines with dextromethorphan can raise serotonin. Herbal supplements like St. John's wort and mood stabilizers like lithium also play a role. Recreational drugs, MDMA, LSD, cocaine, amphetamines, can cause dangerous surges, especially if mixed with prescription meds. The risk is highest when starting, increasing, or adding a new serotonergic drug. Always follow your doctor's instructions and never change your medication routine on your own. Be vigilant during medication changes. Understanding these triggers is the first step in prevention. Stay informed to stay safe. Recognizing serotonin syndrome early can save your life. This condition can develop rapidly and may become life-threatening if not addressed quickly. Being able to spot the warning signs is crucial for your safety and the safety of those around you. Symptoms usually appear within hours of a medication change, especially when starting, increasing, or combining certain drugs. These symptoms fall into three main categories: mental changes, muscle problems, and autonomic instability. Understanding these categories can help you recognize the syndrome before it becomes severe. Mentally, you might feel agitated, anxious, confused, or restless. Some people experience rapid mood swings, hallucinations, or even delirium. You may notice trouble concentrating or feel unusually irritable for no clear reason. Neuromuscular symptoms include muscle twitching, tremors, overactive reflexes, and sometimes muscle stiffness or rhythmic jerking called clonus. You might also notice unsteady movements, difficulty walking, or sudden muscle spasms that are hard to control. Autonomic symptoms affect automatic body functions, like rapid heartbeat, high fever, sweating, shivering, dilated pupils, and diarrhea. You might also experience nausea, vomiting, or feel unusually flushed or cold. These changes can be subtle at first, but may worsen quickly. These symptoms can escalate quickly, sometimes within minutes. What starts as mild discomfort can progress to a medical emergency in a short time. If you notice a sudden cluster of these signs after a medication change, seek medical help immediately. Don't wait to see if symptoms improve on their own. Timely action is essential. Don't ignore mental fog, muscle jerks, or unexplained fever. Even mild symptoms can be the first sign of something more serious. Early recognition is critical. The faster you act, the better the outcome. Quick intervention can prevent complications and speed up recovery. Know the red flags and trust your instincts. If something feels off, it's always better to be cautious and get checked by a healthcare professional. Serotonin syndrome can be serious, but it's treatable. Most people recover fully with prompt medical care, and by stopping the triggering medication. Stay alert to protect yourself and others. By knowing the symptoms and acting quickly, you can make a real difference in your health and the well-being of those you care about. Mild serotonin syndrome is uncomfortable, but severe cases are life-threatening emergencies. The most dangerous complication is extreme hyperthermia, body temperature soaring above 104 degrees Celsius, 40 degrees, which can cause brain damage and organ failure. Severe muscle rigidity can lead to rhabdomyolysis, where muscle breakdown floods the bloodstream with toxins, risking kidney failure and heart problems. Seizures are another critical risk, further raising body temperature and causing injury. If left untreated, these complications can be fatal. Don't wait for symptoms to improve on their own. If you see severe agitation, high fever, muscle rigidity, or seizures after serotonergic medication, call emergency services immediately. Every minute counts in a crisis. Fast action saves lives. How do doctors diagnose serotonin syndrome? There's no single blood test. Diagnosis is based on your symptoms, medical history, and a physical exam. Doctors will ask about all medications, supplements, and substances you've taken. They use guidelines like the Hunter criteria to identify key symptoms, such as clonus, tremor, and agitation. Lab tests help rule out other conditions and check for complications like muscle breakdown or kidney injury. Tests might include blood counts, kidney and liver function, and urine screens. Ruling out similar conditions is crucial for proper treatment. Quick, accurate diagnosis means faster recovery. Treating serotonin syndrome starts with identifying and stopping the medication or combination of drugs that triggered the reaction. This is always the first and most crucial step, regardless of how severe the symptoms are. Healthcare professionals will carefully review your medication list, including any over-the-counter supplements, to ensure nothing is missed. For mild cases, symptoms like tremors, sweating, or mild confusion often resolve within a day or two once the offending drug is out of your system. During this time, rest and hydration are important, and you may be monitored at home or in a clinic to make sure you're improving. Doctors may observe you for several hours or even overnight to ensure your symptoms don't worsen. They'll check your temperature, heart rate, and blood pressure regularly, watching for any signs of complications. For moderate symptoms, such as agitation, muscle twitching, or a mild fever, sedatives like benzodiazepines are often used to calm the nervous system and help you relax. These medications can reduce anxiety and prevent symptoms from escalating. In some cases, doctors may prescribe an antidote called cyproheptadine, which blocks serotonin's effects in the body. This medication is usually given by mouth and can help reverse symptoms more quickly. Severe cases are medical emergencies and require intensive care. Patients may need heavy sedation, cooling blankets or ice packs to lower dangerously high body temperatures, and sometimes a ventilator to help with breathing if muscle rigidity is severe. Supportive care is essential. This includes giving IV fluids to prevent dehydration, closely monitoring vital signs, and treating complications like seizures, abnormal heart rhythms, or kidney problems that can arise from the syndrome. The key to a good outcome is rapid intervention. The sooner treatment begins, the better the chances of avoiding serious complications. Most people recover fully with prompt and appropriate treatment, often returning to their normal activities within days. If you or someone you know develops severe symptoms, such as high fever, confusion, or muscle stiffness, don't delay. Get to the hospital as quickly as possible. Early action and medical support make all the difference in recovery from serotonin syndrome. Preventing serotonin syndrome starts with you. Keep an up-to-date list of all medications, supplements, and over-the-counter products you use. Share this list with your doctor and pharmacist every time you get a new prescription. Ask questions. Does this medication affect serotonin? Could it interact with anything else I'm taking? Pharmacists are experts in drug interactions. Use their knowledge. Be cautious with over-the-counter products, especially those containing dextromethorphan. Always read labels and ask if you're unsure. Never change your medication dose or schedule without consulting your doctor. If your medication isn't working, talk to your healthcare provider. Don't self-adjust. Stay proactive and communicative. Your health is a partnership. Be an active participant. Small steps can prevent big problems. Stay informed. Stay safe. Let's recap. Serotonin is vital for mood and health, but too much can be dangerous. Serotonin syndrome is serious but preventable and treatable if caught early. Know the common triggers: medications, supplements, and recreational drugs. Watch for the classic triad: mental changes, muscle symptoms, and autonomic instability. Early recognition and action are key to recovery. Your health is in your hands. Ask questions, stay informed, and work with your healthcare team. Never hesitate to speak up about your medications or concerns. If you're worried, talk to your doctor. They're there to help. Stay vigilant, stay healthy, and take charge of your well-being. You have the power to protect yourself and those you care about.